Now, what are some of the early signs that a hormone imbalance may be affecting performance?
What happens with guys and women, they will have fatigue, they will have memory and focus issues, mood disorders of all kinds. I mean, I've worked with therapists for years, very often because what therapists will see is that they can do a lot with behavioral psychology and the various techniques that are used in therapy. And then they'll hit like a wall if that patient has some other underlying issue, whether that be thyroid, which thyroid is probably one of the most common things as it relates to mood disturbance, definitely hormone deficiencies like testosterone for men. So men will deal with, I would say the movie Grumpy Old Men, and they're grumpy not because they have too much testosterone. They're grumpy because they don't have enough. So we often think, oh, guys, he's all, he's aggressive and irritable because he's all filled with testosterone. No, actually, testosterone helps to mitigate mood. It helps to mitigate stress resilience. It allows for stress resilience. It is a massive um, mitigator for dopamine. So it'll help you to produce dopamine, keep dopamine around. And as you know, I'm sure that dopamine is, I always call it the happy hormone. It makes us irrationally optimistic, which can be good if we're dopamine deficient. Obviously, in mania and all of that, you can be dopamine
You can be
excess. I don't
over
want that either.
dopamine, but yeah, certainly
Right.
in the process, dopamine definitely plays a role for excitation,
Yeah.
and the like. Um,
Correct.
okay, so it sounds like again fatigue, memory loss, mood. These are some of the things that might go in tandem with a function issue. That would be a sign, again, a sign
Yes.
that hormone imbalance may be playing a role.
Yeah, and then also sort of other interplay hormone systems. Again, thyroid could be part of it. Probably more commonly with men, you'll see some type of dyslipidemia, which is the fancy word for just high cholesterol. There's also other metabolic issues like just weight gain. There could
Mhm.
be excessive sugar, glucose that makes the hemoglobin A1C go up. And so they have what's called metabolic syndrome that I always say I've never once seen a guy who has sort of pre-diabetes, insulin resistance, and metabolic syndrome that doesn't have low testosterone. They're massively intimately related. And then that, of course, all in turn also affects their function, because what's really important for erectile function is your endothelial system. And that's, again, the fancy word for the lining of the blood vessels. So we're thinking about heart, of course, when we're talking about blood vessels, but I would say the is the weather vane of the cardiovascular system. It is telling you what's going on the inside. So if you're beginning to have ED issues, even mild ED issues, that's the early signs of what might be going on inside with blood vessels and all of that. So we really approach that very accurately to be able to help with that too.